We have an amazing guest. Tulikocha introduce Dr. Misiani. Musa is in the building, COO Jubilee Health Insurance. And of course, the topic is very simple: health insurance, a lifeline, not a luxury. Right now, we'd like to just start with the simplest of questions. So we often believe that we don't need insurance. When I get sick, I'm just like, nitameza dawa, 3 days, I'll go to Hosi. That's like the Kenyan way of doing things. So the question is, why should I take health insurance cover while I can buy over-the-counter medicine when it failed? You know, when I feel sick. Yeah.
Very dangerous proposition there, actually. Self-treatment is not necessarily the best of approaches to treatment. But I think the fundamental problem that would lead to something like that is lack of access and a problem with having access to financing. So the problem that we have in this country, for example, is a majority of treatments are actually quite expensive and out of reach for many people. So usually you would rather take a shortcut and maybe get over-the-counter medication, like you said. The problem with that is that sometimes you'll find that some sinister diagnoses may be missed, or you may actually go for treatment over the counter, you don't get better, you actually either downplay the issue and then it gets worse. You may actually miss an opportunity for early detection for some illnesses. So it's usually not a good idea to actually, self-treat. So then how do we address the issue that, okay, fine, I do not want to self-treat, but at the same time, I also do not want to spend out of pocket. So that's the role of health insurance right there. Because what your health insurance would do, beyond giving you curative care, a majority and a lot of health insurance covers currently actually allow you to be able to access preventive care as well. So you'll find that there are many covers, and at Jubilee we do a lot of that. You will find a lot of covers that have wellness riders to them. So we're able to give you access both to curative and preventive medicine. And just a peace of mind that when I'll get sick, I'll be sorted through and through. Right from the diagnostics, right, if it requires admission, if it requires whatever intervention, the peace of mind that having a health cover gives is much better than just putting a wager on and a risk on your life that, okay, yeah, if I get sick, I'm just going to get the meds and then I'll be sorted. Yeah.
The fact that we think of it as a big financial, commitment to make, but on the flip side, it can also mean financial security for you, right? How does health insurance play into financial security for everyone long term? Because I think you think of the number, you're like, they want me to pay how much per year? I know, and it seems like a daunting figure.
Yeah, absolutely. A health insurance cover should be part of anyone's financial plan. Because, we've all had the cliche of, we are one hospital bill away from poverty, and that's probably true for a majority. And insurance is a business of risk, so you can either accept the risk or transfer it or control it and so forth. So in this case, you're transferring the risk to someone else to be able to bear that for you. And if you think about, for example, and I'll give a specific example of this country, where total health expense and catastrophic health expenditure continues to be a big problem. Because say, for example, you get ill and it's a critical illness. An average admission in an ICU per day in Nairobi may cost you maybe 200, 300,000 shillings per day. Sometimes it can even go up to 1 million shillings. I don't think many of us have that sort of disposable income just readily available to be able to cater for that. So the peace of mind that comes with having insurance is that, this underwriter would be able to carry that risk for you. So that one, it doesn't necessarily, you don't incur the expense of, and usually healthcare is quite expensive. You don't incur that expense as part of unplanned expense. And no one plans to be sick, really. So, this is really a chance occurrence. And you'll find that it happens to you by chance and you've not planned for it. And maybe you didn't have enough savings for that. Then it wipes out your entire savings. Yeah.
There's a lot of things that come to play. One of them, cultural reliance, in that you've said we're in the culture of so-and-so is sick, so let's raise some money. And that's the culture, really. What are some of the limitations in that? Because for us, it's more like, I don't know how to say it, but we pulling together is what we call it. And you've said that culture also comes to play when we say, sisi hatukuangi wagonjwa. And so I don't see the need of having a long-term plan for sickness. It's like I'm inviting bad luck on my side. So like from where I come from, if you prepare for such a thing, it's like kuna prepare kwa mgonjwa.
Yeah.
So just talk to us a little bit about cultural reliance and how it the limitations of it.
Yeah, so I think all of us have probably been in a WhatsApp group when someone is unwell and we're raising funds, or we see a social media appeal, and it may work to some extent. The problem with that's quite unpredictable. So you'll find a situation where if you're going to rely on family or friends to be able to support you when you are in the hour of need, what happens if they're not able to? What happens if the bill is 5 million and they raise 250,000? They have, and especially in times of economic difficulty, people may not have as much money as disposable enough to be able to share, across. I understand that, our culture is built as a social culture, that we support each other in the hour of need, the Harambee spirit and whatnot. But then what health insurance does that is particularly a big advantage over such a plan is, you can be able to plan for your money. You can be able to very comfortably know that in case I fall sick, this insurer is going to cover my expenses up to this extent. And then you actually even just, the social embarrassment. Not all of us can be able to form a WhatsApp group and go out and make appeals. No, it requires a certain level of courage to do that.
Yeah.
It does, yeah.
But even beyond that, medically speaking, the time that you're taking to raise the amount of money required for you to get that treatment, the condition could be getting worse. So just to be able to plan yourself, and like I mentioned earlier, this is part of your financial plan. Plan yourself, planning your health. It's very important to have predictability in the sense that, my health insurance is going to come through and they're going to help me, be able to cover my hospital expenses.
We'll say